Picture this. You're sitting with your family at the dinner table when you begin to develop unexpected weakness on the left side of your body. Your face feels droopy, your arm grows weak, and your speech is slurred. All telltale signs of a large stroke. According to the American Stroke Association, a stroke is a medical emergency in which blood flow to the brain is reduced or restricted, and urgent medical care is critical. So you call 911, are rushed to the hospital, and among other scans receive a CT scan. As mentioned before, urgency in ischemic stroke is critical. A common phrase coined by AHA stroke journal author Jeffrey L. Salver is this: time is brain. From the moment you call 911 to the moment you receive proper care, every second counts in saving your brain. Because for every second a stroke is untreated, 1.9 million neurons die. However, because of typical standard stroke workflow in the United States, you may be waiting hours before receiving the proper care, as many patients often languish in hospital rooms waiting for care that comes too late. A string of doctors must individually review the scan before the right care can be decided upon, and this process takes a long time. The technologist must individually review the scan, then send it to the radiologist, and it might not be available to the radiologist for about an hour. Then the radiologist must send that same CT scan individually to the ED clinician, the neurologist, the interventionalist, and finally the correct specialist. This linear flow of standard stroke workflow takes an average of 180 minutes or 3 hours. Now multiply that by 1.9 million neurons dying each second. Even then, stroke is often a medical mystery. It's hard to diagnose, as many stroke symptoms can be mistaken for seizure, alcohol or drug abuse, etc. Mere seconds are the difference between life and death, but also leading a normal life versus leading a life of disability. The CDC cites that stroke is the 5th leading cause of death in the United States, but the number 1 leading cause of disability. In the United States alone, a stroke occurs every 40 seconds, with a stroke-related death occurring every 4 minutes. Almost all stroke-related deaths and disabilities are caused by a lack of urgency in finding the right care. So what if the right doctors could instantly see the right patient at the right time from their cell phone? VIZ is a company that has revolutionized stroke care by triaging patients and reducing the overall time it takes for patients to receive the proper care. VIZ uses AI technology that detects signs of stroke on CT scans using an advanced learning algorithm, pulling from years of medical research. When VIZ detects signs of a large stroke, it sends push notifications to the entire on-call stroke team on a multi-hospital network, providing them with a real-time scan. The right doctors and right specialists are then able to communicate via a secure text messaging pathway, and the right care is often found within minutes. Let's look at how it works right from the VIZ training module demo app. This 71-year-old male received a CT scan at St. Hill Hospital, and VIZ connected to the CT scanner and used AI to automatically analyze scans. The VIZ technology immediately identified a suspected large stroke in real time and sent positive alerts directly to the on-call stroke team, providing them with a real-time scan as shown on the right that can easily be manipulated. The doctors can then discuss the diagnosis within a secure text messaging pathway, and the right care is found within minutes. Instead of contacting the right specialist if a stroke is suspected to be occurring, the right doctors and right specialists are actively engaged and instantly communicate on diagnosis and the correct treatment pathway, quickly deciding upon the right care, oftentimes while the patient is still in the CT scanner. According to Dr. Chris Mancy, CEO of VIZ in a mere 5 minutes, 100 years of stroke treatment experience are often viewing a case at the same time. The normal stroke workflow takes 180 minutes, but using VIZ synchronized stroke workflow is reduced to 30 minutes. Significant results can be seen in stroke workflow across hospitals that have implemented VIZ. In a recent research study conducted at Valley Baptist Hospital in Texas, physicians and doctors saw an improvement of 66 minutes to treatment per patient on average after implementing VIZ. Compared to the standard of care before VIZ saved an average of 3.5 days per patient in the ICU, reducing overall length of stay by 2.5 days. ICU beds and ventilators are in high demand now more than ever, with a dramatic increase in COVID cases. If patients can be moved out of the ICU at a quicker pace, this frees up beds for other patients in critical condition, especially COVID patients. VIZ AI has revolutionized stroke care in hospitals across the country, using advanced medical algorithms to quickly detect signs of stroke and notify teams within minutes across 400 hospitals. By implementing VIZ AI, hospitals can save hours of time in the diagnosis and treatment of patients, and the right doctors can quickly communicate and treat the right patients at the right time. As Dr. Tom Devlin from Erlanger Hospital in Tennessee summarizes, and reviewing images on our phone literally within minutes after a scan without waiting for other physicians to call us, or waiting for an outside radiologist to read the images. This is facilitating change like no other application to come before it. Many more patients will be treated, many more patients will recover, and many more patients will live. Thank you.